Now, a report by a parliamentary committee on centre's handling of COVID situation in the country has found glaring lapses in the healthcare system. The report highlights that inadequate facilities at government hospitals and lack of specific guidelines for COVID treatment resulted in private hospitals charging exorbitant fees, asserting that a sustainable pricing model could have averted many deaths. This is the first report by any parliamentary committee on the government's handling of the COVID situation in the country. I am joined by my colleague Ayushman from New Delhi. Ayushman, what we have in fact seen is that there have been, of course, several measures which have been put in place by the centre, by the state governments in terms of making sure that the healthcare facilities are adequate for people amid the pandemic. But this parliamentary panel report actually does not mince any words, clearly points out where the gaps lied, and also essentially saying that there needs to be a sustainable pricing model, or there needed to be a sustainable pricing model in order to save more lives during this pandemic that we have been facing for several months now.
Yes, Tanima, in fact, the panel is being headed by Ram Gopal Yadav, who belongs to the Samajwadi Party. And in this panel report, it has been submitted to the Vice President Venkaiah Naidu. It has clearly means no words, like you pointed out, to criticize the kind of management that the government had on ground. And it has clearly said that in absence of any guideline over treatment, because the government hospitals were already in abysmal condition, this led the private hospitals to charge exorbitant fees from people who were actually in need of treatment. Apart from that, Tanima, there are several other points as well on which this committee's report slams the government. It has said that the health infrastructure spending in India is very low, and it has to be it has to go up to 2.5% of the GDP by 2025. On the issue of testing and tracing, somewhere it points out that the proper surveillance could not take place, and despite the containment strategy and lockdown, the government's efforts on ground failed, and that is why we are seeing a huge spike in number of cases. And it has told the government that in order to contain such situation in near future or in future, the basic health infrastructure of the country should improve, because even in rural areas and also in urban areas, the health infrastructure is in very poor shape, and that has to be looked into in coming times.
Right, Ayushman, stay with us, as there are several other aspects of the parliamentary panel report that we are looking at, because it also highlights how the spending on healthcare in the country, with a population of 1.3 billion, is abysmally low, as a result of which people had to undergo trauma and distress due to absence of a dedicated healthcare system. The committee observed that the number of government hospital beds in the country were not adequate to handle the increasing number of COVID and non-COVID patients. In fact, Ayushman, coming back to you, we have seen your reports as well as several other reports that we have presented in front of our viewers over the past several months, where it's not just COVID patients but also non-COVID patients who have had to suffer because of the lack of infrastructure that we have been pointing out, or poor infrastructure that we have seen in several states, which have in fact been put to a severe test amid the pandemic. And that is also something that the parliamentary panel report picks up on, that overall the general sense that they gathered after looking at all the aspects of the issue is that the healthcare, spending on healthcare is really low, considering that we have such a huge population.
Yes, Tanima. In fact, if you see the condition right now of the national capital, we have seen all the beds in the ICU beds, the oxygenated beds in the private hospital getting occupied. People are reluctant to go into the government hospital, despite the fact that the state's government has clearly said that for past 6 years, they have been working upon the infrastructure of government hospitals. This is the state of affairs in the national capital. If you go towards northern India, the healthcare infrastructure of government is absolutely collapsing. Now, that has been pointed out in this. It has been said that currently, if you see the GDP spending of health, it is somewhere in 1% and more than 1%, which has to be taken to 2.5% in coming 4 years, because it is very important to ascertain the kind of enormity of situation that is there in the health infra right now. The government infrastructure has somewhere failed to cater the needs of people who are there in need of better treatment. Apart from this, they have already said that because government did not have a proper guideline, and if you remember, Tanima, we had also pointed out in several press conferences that government has yet not drafted anything. They left it on the private infrastructure to follow their own guideline and regulate themselves, which actually led to increase in pricing. There were certain state governments which actually regulated the private hospitals charging, but apart from that, overall scenario, people were in fact charged exorbitant amount, and because of the health infrastructure in government sector becoming very low, the private were seeing the increased patients, and that's why large number of exorbitant fees were being charged from that side, and that has been highlighted in this report as well, Tony.
Right, Ayushman, thank you so much for joining us with all the perspective on that very important parliamentary panel report on COVID.